Well, bullying and cyberbullying on social media can be a significant risk factor for depression, substance abuse, even suicide.
A new study by Dr. Megan Moreno, professor of pediatrics at the UW School of Medicine, shows that reporting on this important issue by the media may be framing the issue incorrectly. The study was recently published in the journal Prevention Science, and Dr. Moreno is here to discuss what she found. Nice to see you.
Welcome.
Yes. Thank you for coming. So this is very interesting. You looked at national newspaper articles over a 5-year period from 2012 to 2017. And what specifically were you looking for?
Well, this study was really motivated by a patient story where a patient, when I asked her if she'd ever been bullied, she said, well, I thought maybe I'd been cyberbullied, but I haven't killed myself yet. And I said, what? And she said, well, most of what I've learned about bullying has come from reading the news. And it seems like in the news I see stories about cyberbullying and suicide. So we really wanted to understand what that looked like and did this study looking at newspaper articles.
Difference between bullying and cyberbullying, the articles.
Yes, we did. We looked at over 400 articles and we grouped them whether they've primarily focused on bullying or focused on cyberbullying. And we compared the type of language and the type of words that they use to describe those bullying stories.
And what were you looking for specifically? Words that you tell me.
Yeah, we were looking for words that might be associated with things like fear or hopelessness, and then we were looking at words that got at things like prevention or intervention or ways to help. And maybe not surprisingly, what we found is that for the cyberbullying articles, there were more words that related to things like fear or anxiety or anger or even death compared to the way that the bullying articles were written.
So what words should be used instead?
Well, I think some of it has to do with maybe realizing that a lot of the stories about cyberbullying the last 5 years have had sadness and anxiety. So it's not that using those words is bad. I think it's that what we're thinking would be more helpful to people like my patient would be to integrate some words around prevention or intervention or hope into some of those stories that we now know teens are reading.
So it's basically trying to achieve more of a balance.
Yeah.
Addressing the very important issue, but then offering resources or avenues for help. Is that basically
exactly.
what needs to be done
I think sometimes telling these stories, these are scary stories and they are tragic stories, but bringing in that element of if you're worried about someone, here's what you can do, or if this happens in your community, here's some resources for you.
So your best hope is to get this word out to reporters and editors and publishers?
I think so, and I think also to our community of pediatricians, just knowing that our adolescents today are getting health information from the news they read and being able to help them process that and think about that.
Are there any specific words that you think shouldn't be used?
I think one word that we've heard from teens, and I've certainly heard from patients in my clinic, is the word epidemic with cyberbullying. At this point is a little overused, and we understand so much more about how bullying and cyberbullying often coexist. So I think epidemic is one word that's probably lost its luster at this point.
It sounds like an illness or something, a virus.
It does, or it sounds like something we can't control or we can't stop, and so it gives that feeling of hopelessness.
Raising awareness, that's the important thing.
Definitely.
Thanks for being with us today.
Thank you.
Great to see you. Very interesting.
Continue the good work.
Thanks.